I'm Shannon with Nursing Education, and I'm here today to show you how to apply soft restraints to a patient. This skill can be performed by any unlicensed caregiver professional. So what you'll need for this skill is a set of restraints, and they are the soft ones, so they're the soft Velcro like this. You'll have a set of 2 per pack. Some important things to remember at the beginning are you never want to do this alone ever. So if you need to put somebody in restraints, then the nurse also needs to come into the room, or more colleagues. You would never put a restraint on just one side of the patient. It's either both arms, both feet, or all 4, but never just the right arm, for instance. But for this video, I'm going to show you how to apply one restraint. So I have the whole one soft restraint here, and there's 2 pieces to it. So there's a short 9-inch piece, and then there's the longer strap, and they both go in together. So the first thing we're going to do is just disconnect the strap here, so you have the smaller piece. We want to attach this to the bed first. So on our beds, if you come down here, you'll see that there are 2 brackets that are they're on the movable part of the bed, meaning if I go up and down, it's moving with the actual bed frame. If I put it down here, this would be non-movable where my foot is, because if I bring the bed up, it's not moving with the patient. It's going to stay down there. So it's important to pick one of those, either this bracket or this bracket over here, and we want to secure it. So I'm going to choose this one up here. This is one long piece with a loop, so we want to bring the loop through the loop of the bracket, and then the actual buckle part is going to go through the smaller loop, and then we're going to tighten. So you can see it won't remove from the bed. After we have that secured, then I'm going to take this longer piece that's attached to the restraint and buckle that in, and then I'm going to move up to the patient. So we have it secure on the bed first, moving up to the patient. The bottom part of the restraint is soft in blue. You're going to put this underneath the patient's hand. Obviously, if you're putting a patient in restraints, they're not going to be this easy to put it on, so just remember that too. We're going to wrap this around the wrist, so it'll go like here and then there. This Velcro piece just goes on the other side. You want to make sure that one finger can fit between the skin of the patient and the Velcro piece, on the bottom of the Velcro piece. Then we're going to take the remaining piece of the restraints here, and we're just going to twist once. So as you can see, there's a little twist there, and then you can buckle in the remaining buckle there. Tighten that. There's a little piece of Velcro on the back that can roll around and attach on the other side to the actual restraint. And then you want to make sure that where the twist was, you can fit one finger underneath. Then once you have this on the patient, you're going to make sure to tighten it to the appropriate length so that they can't reach whatever they were originally trying to pull out. So I'm just going to tighten it here in the middle. And now the patient has enough room for circulation and movement, but not enough to pull out the medical device. After you've applied both sides, if for some reason you had to take them off, then you would need it to be told by a nurse first. And if you're in an emergency, then you would go ahead and do the quick release, which is right here in between. And that way the patient and the medical team has full access to the patient. If it's not an emergency, then you want to take it off from the patient first and then go down to the bed. You never want to keep the restraint on the patient. All right, thank you.